Welcome to our educational video on genitourinary system, also known as the urogenital system. It is a complex network that regulates the body's production and excretion of urine and reproductive processes. The urinary tract includes the kidneys, ureters, bladder, and urethra. They work together to filter blood, remove waste, and regulate fluid balance. Starting with the kidneys, these bean-shaped organs filter waste and fluid from the blood and produce urine. The urine then travels down through narrow tubes called ureters to the bladder, where it is stored until excretion. The bladder is a muscular sac that holds urine until it's ready to be expelled from the body through the urethra. This system is closely related to the genital tract. In males, the urinary and reproductive systems share structures such as the urethra, which serves as a conduit for both urine and semen. The prostate gland is a part of the reproductive system that surrounds the urethra below the bladder, affecting both systems. In females, the urinary and reproductive systems are distinct but closely located, with the urethra opening just in front of the vaginal opening. Now, let's look at some of the most common genitourinary diseases. First is the urinary tract infection or UTI. It occurs when bacteria enter the urinary tract through the urethra and begin to spread. Common symptoms are pelvic pain in women, burning feeling when urinating, and a strong urge to urinate that doesn't go away. Sexually transmitted infections or STIs like herpes, chlamydia, gonorrhea, and syphilis can affect the GU system and may lead to infertility and urinary problems if left untreated. Kidney stones are hard deposits made of minerals and salts that form inside your kidneys. Diet, excess body weight, some medical conditions, and certain supplements and medications are among the many causes. Signs and symptoms of kidney stones can include severe pain, nausea, vomiting, fever, chills, and blood in your urine. Chronic kidney disease involves a gradual loss of kidney function that can cause a buildup of fluid, body waste, or electrolyte problems. Factors that can increase your risk of chronic kidney disease include diabetes, high blood pressure, heart disease, smoking, and family history. Kidney cancer is cancer that begins in the kidneys. It usually doesn't have signs or symptoms in its early stages. In time, signs and symptoms may develop, including blood in your urine, which may appear pink, red, or cola-colored, pain in your back or side that doesn't go away, loss of appetite, and unexplained weight loss. Bladder cancer most often begins in the urothelial cells that line the inside of your bladder. Urothelial cancer can happen in the kidneys and ureters too, but it's much more common in the bladder. Symptoms include blood in the urine, painful and frequent urination, and back pain. Next on our list are prostate issues, such as benign prostatic hyperplasia, or BPH, and prostate cancer. BPH is also called an enlarged prostate, and it often gets bigger as you get older. Prostate cancer is one of the most common types of cancer. Many prostate cancers grow slowly and are confined to the prostate gland, where they may not cause serious harm. However, prostate cancer that's more advanced may cause signs and symptoms, such as trouble urinating, blood in the urine and in the semen, and erectile dysfunction. Testicular and penile cancer are cancers that can also affect the genital tract in men. In females, conditions like interstitial cystitis and pelvic inflammatory disease, or PID, can impact the genitourinary system. These diseases often cause chronic pain and discomfort, affecting the quality of life. In cervical cancer, various strains of the human papillomavirus, also called HPV, play a role in causing most cervical cancers. HPV is a common infection that's passed through sexual contact and can also cause penile cancer. You can reduce your risk of developing cervical cancer by having screening tests and receiving a vaccine that protects against HPV infection. Ovarian and uterine cancers are cancers that can also affect the genital tract in women. Other causes of GU problems include traumatic injuries from accidents or sports, congenital conditions like hypospadias and epispadias, autoimmune diseases such as systemic lupus erythematosus, or SLE, metabolic disorders like polycystic ovary syndrome, or PCOS in women, or hypogonadism in men, and lastly, psychological and social factors. Diagnosing genitourinary diseases typically involves a combination of medical history review, physical exams, urine tests, blood tests, and imaging studies like ultrasounds or CT scans. Treatment varies depending on the specific condition. It can range from antibiotics for infections, medications to manage symptoms, lifestyle changes, to surgical interventions in more severe cases. Early detection and treatment of genitourinary diseases are crucial for preventing complications. Regular checkups, screenings, quitting smoking, and maintaining a healthy lifestyle can help manage and reduce risks. Thank you for watching, and don't forget to share this video with your friends and family. We would greatly appreciate your feedback and suggestions. This message is proudly presented by Minneapolis Health Clinic and Totoe Health Equity Project, dedicated to your well-being.